Welcome to Q4CD Lecture Series, brought to you by Questions for Cancer Doctors, where we believe in patients' empowerment through knowledge and advocacy. Today, we will be talking to you about the basics of cancer that everyone should know.
An overview of our discussion today includes an approximation of cancer statistics in the United States, how cancer develops, its diagnosis, staging, and a basic approach to treatment. Cancer remains the second leading cause of death in the United States of America, exceeded only by cardiac-related diseases. Despite our many advances, there are still many who have not taken advantage of available treatments, be it for fear or for not understanding the benefits of treatment. 50% of all males and 1/3 of all females in the United States will develop cancer during their lifetime. The important thing to know is that millions of people are living with cancer or have had cancer and are living cancer-free after their treatment. There is hope. There are some things that you may do to help reduce the risk of developing some types of cancers. Quit smoking, decrease sun exposure, increase physical activity, and have an improved high-fiber diet. There are some who seem to do all the right things, yet still, be it genetics or some other unknown factors, unfortunately are diagnosed with cancer. We do not know why, and in some cases doctors will tell you they just don't know why. But cancers found early, even before symptoms become evident, are more likely to be treatable or even curable. The sooner a cancer is found and treated, the better the chances are for living a longer, cancer-free life. In general, the most commonly diagnosed cancer is skin cancer, so very common in fact that the overall numbers are usually not recorded and are not shown. The leading cancer diagnoses in males are prostate, lung, and colon, while in females it's breast, lung, and colon. The number diagnosed in the U.S. is listed along with the overall percentage. The corresponding information is listed for other commonly diagnosed cancers. Well, that's it for statistics. That information was just to let you know you are not alone. Now let's review how cancer develops at the cellular level. DNA is the basic building block of all living things. This illustration depicts a normal schematic of DNA. A carcinogen, such as overexposure to sunlight, may cause mutation or damage and ultimately leads to cancer, such as skin cancer in this example. This is an overgeneralized illustration of a normal cell versus a cancer cell. A very common myth that exists today is that everyone is born with cancer cells. That is simply not true. Cells are inherently normal. Something occurs to cause DNA damage that may subsequently cause cancer. If everyone had cancer cells, then everyone would get cancer, and that is not the case. Normal cells will grow and divide when the body needs them. These cells will die if they are damaged or if the body no longer needs them. These can then be replaced with new cells. A tumor develops when this process goes wrong. If damaged or old cells do not die when they should, or new cells are formed when not needed. When the DNA of a cell is damaged, its growth is no longer regulated. It divides more rapidly. It starts to grow haphazardly and begins to compete with normal cells for space and nutrients. As the cancer cells grow, they become too big for the cells to get oxygen and nutrients from the main blood supply. From this point, two things can occur. They either send messages out to the main blood supply to grow additional branches. This is called angiogenesis. Or, if the message sent out is blocked or angiogenesis does not occur fast enough, the cancer cells located in the center will begin to die. This process is known as necrosis. However, the outer cells, closer to the blood supply, will continue to grow haphazardly. As the cancer cells continue to grow, the normal boundary of the organ will try to prevent it from breaking through its barriers. This barrier at the cellular level is known as the basement membrane. When a cancer is discovered at this stage, it's called carcinoma in situ, meaning the cancer did not penetrate through the basement membrane barrier. This is a very common diagnosis. An example is seen in breast cancer. This denotes a very, very early stage called ductal carcinoma in situ, or DCIS, of the breast. As the cancer cells continue to grow erratically, the membrane will no longer be able to contain the cells, and the cancer cells will eventually break through. As cancer cells invade through this barrier, it is then described as invasive cancer. The time it takes to go from in situ cancer to invasive cancer varies tremendously, months in the aggressive types, while in other slow-growing cancers, this transition may take years. It all depends on the location and type of cancer. Your oncologist will be able to tell you more. During this invasive process, the cancer cells may escape into the blood vessel or the lymphatic vessels. We will discuss the lymphatic system in another presentation. Cancer cells can grow and become invasive by breaking through the barriers and spreading to other areas. They may do this by direct extension, developing finger-like projections into nearby organs, or creep along the nerves. Or cells can also escape into the blood vessels or the lymphatic system and move into other areas. For example, if someone is diagnosed with advanced prostate cancer and then cancer cells from the prostate are found in the brain, that is called metastasis. It has traveled a long way from the area of origin. We will discuss later how chemotherapy helps to combat the possibility of developing metastases or in treating metastases. Now we know the basics of cancer. How does someone with cancer present? What's the diagnosis process, that is? How can your doctor find out if you have cancer? Let's talk about the general sequence of what happens during the diagnosis process. Usually, a person presents with a symptom, meaning something perceived by the patient, such as pain, shortness of breath, headaches. A doctor would have to be told these things. Signs are things that the doctor can see or feel: a lump in the breast, an abnormality felt on the prostate during a digital rectal exam, or sometimes neither. Perhaps it was detected during a specific screening such as a mammogram, colonoscopy, or routine exam for some other unrelated issue. Let's say you went in for a chest x-ray prior to an elective surgery, and that x-ray showed a nodule. The first thing your doctor will want to do is investigate the abnormality. They may refer to it as a tumor. A tumor may or may not be cancer. There are two types of tumor: benign, which are non-cancerous, and malignant, which are cancerous. Malignant and cancer are oftentimes used interchangeably and mean the same thing. Neoplasm is also used interchangeably with cancer. In order to know if your tumor is a cancer, your doctor may recommend a biopsy. They will take a small piece of the tumor or tissue sample. Sometimes the location of the tumor is in a sensitive area such as the brain, and tissue sampling may be very difficult. In these cases, your doctor may recommend a special radiographic test such as a CAT scan or MRI. These radiology tests have certain features that may tell if a tumor is benign or cancerous. Once the tissue sample is obtained, a skilled doctor called a pathologist will examine the sample under the microscope, and by certain features and special stains will be able to diagnose the tumor. There are over 100 different types of cancers, and each affect a different part of the body. As you can imagine, sorting out this information can take some time, so you may wait anywhere from 3 days to a week for the pathologist to be certain of the diagnosis. Sometimes they may even send the tissue sample to a second location or a more specialized pathologist if it is an unusual tumor. Just know that the pathologist does understand how anxiety-producing the wait can be, but they are working zealously behind the scenes to make sure they give you the correct information. After the cancer diagnosis is made, your doctor will need to find out much more about how the cancer is behaving. In order to do this, several other tests must be done. You will be sent to the laboratory in the hospital where blood will be drawn and evaluated for certain things, such as tumor markers. They're called PSA in prostate cancer or CA-125 for ovarian cancer. These tumor markers are very important as they give your doctor an idea of just how much cancer may be present in the body, commonly referred to as tumor burden. They can watch these numbers as they are expected to decrease with treatment. This would be an indication of a favorable response to treatment. Additionally, they want to make sure that the cells responsible for carrying oxygen all over your body, or hemoglobin, are high enough. Other tests will include ways to take a look inside your body. You may be familiar with some of them. Others may be new. CAT scan or CT scan, MRI, as seen here, PET scan, mammogram, and ultrasound, to name a few. Each serves a different function and gives your doctor different information. Here is a chest x-ray. You can see the outline of the heart and the spine. For example, a chest x-ray may show a nodule in the lung, but a PET scan can tell if it's functionally growing and more likely cancer versus something benign. Other evaluations may include colonoscopy for colon cancer or exam under anesthesia for head and neck cancers. These are done while you are asleep. Once the information is gathered, then your doctor will discuss staging with you. Staging is the process whereby all the information is used to determine how best to treat the cancer. Things your doctor will consider for this staging are: how aggressive does it look under the microscope? What is the size of the tumor? Did it invade any surrounding tissue or organs, or travel to the lymph node? Did the cancer leave the site of origin and spread somewhere else? Is there a blood marker that was looked at, and if so, how elevated is it? Though staging is important, it can be very complicated. Be sure to review Understanding Staging in the member section and/or discuss this with your oncologist. Okay, let's briefly discuss the available treatment options for cancer. The mainstream treatment options widely recognized in the United States include surgery, chemotherapy, and radiation therapy. There are other treatment options that are currently under investigation, and some others that are not approved by the FDA. Their appropriateness for cancer treatment, success, or lack thereof will not be addressed on this site. In this forum, we will be discussing what is considered the standard of care in the United States. Multidisciplinary appointment is the approach whereby all the staff involved in your care will see you, medical oncologist, surgeons, radiation oncologist, social workers, research assistants, and anyone else your institution may deem necessary. A final decision or recommendation about treatment will be made at that time or soon thereafter. The oncologist, doctors who specialize in cancer treatment, will discuss all your treatment options with you. Be sure to have a family member or loved one with you during these appointments. Surgery. The goal of surgery is to remove the cancer from the area of origin and from any other area that it may have spread to locally, such as the lymph nodes. Before any surgery is done, your doctor will do an evaluation to make sure that you are able to tolerate the planned surgery and anesthetics, or the medicines they use to put you to sleep and control pain in preparation for the surgery. There are many locations where cancer can develop, so the type of surgery and the associated risks will differ dramatically. Chemotherapy. This is given through your vein and in some cases in pill form to help eradicate any cancer cells that may have escaped from the point of origin and are trying to spread to other distant locations via the bloodstream or lymphatic system. Because it has the ability to go anywhere there is blood in your body, the side effects are usually manifested throughout the body and can lead to nausea, hair loss, and numbness in the fingertips, to name a few. Not all chemotherapy causes you to lose hair. Depending on the type of cancer, the chemotherapy regimen may vary. Radiation therapy is different from chemotherapy. It is given as a local treatment. It is a very powerful treatment that affects only the area in which the beam is directed to kill cancer cells. The side effects are limited to the normal tissue that is close to the vicinity of the tumor that is being treated. For example, the rectum is very close to the prostate. One of the side effects for treatment of prostate cancer is loose stool or diarrhea, which tends to occur a few weeks into the treatment. The side effects from radiation is often described as a moderate sunburn in the area being treated and builds up over time, usually weeks. just as getting sunburned does not happen all at once, but builds up with exposure to the sun over a few hours. However, unlike chemotherapy, which is systemic and goes everywhere, radiation therapy does not. It is a local treatment. So in essence, if you are being treated with radiation therapy for prostate cancer, you will not lose the hair on your head. Likewise, if you are being treated with radiation therapy for breast cancer, you will not have diarrhea from radiation therapy for breast cancer. Today we covered the basics that everyone should know about cancer, as listed here on the summary slide. We hope this lecture series was educational and beneficial to you. Let us know what you think. Please take advantage of all the information available in the membership section. This brings us to the end of the first lecture in our series. We hope this brief introduction on the basics of cancer brought some clarity to you and your loved ones.